We are back to talk with Dr. Kyle Kiesel, who works closely with Mainstay Medical and the ReActiv8 device. Thank you so much for being here with us today.
Oh, thank you so much for having me. It's exciting to have an opportunity to share everything that we've learned over the last really almost 15 years as we've developed this particular device to help those with chronic back pain.
No, absolutely. I know you're the Senior Director of the Functional Programs and Education at Mainstay Medical. Were you their first employee?
Kind of. I came from academics. I'm a physical therapist and a researcher, and I did all my PhD work and early research in multifidus measurement, dysfunction, and back pain. And so the founder of the company back in 2009 actually just cold called me and started to ask me to help with the development of the product. So I consulted with Mainstay really since that time, and stayed in academics over 20 years. And then recently, within the last year, came on with Mainstay full time to help lead this team of physical therapists that we have to help get the message out.
No, that's amazing. And I know you have almost 40 peer-reviewed publications as you've been doing this work for so many years now, but it's really changing the field for us as pain management physicians.
Yeah, big change. In physical therapy, our research arm is quite strong across the world, and we've been looking at muscles and motor control and core function for forever. Like that's what we do. And so we've been studying multifidus. The first paper I read was 1994. I started to follow it at that point. There's probably 10,000 papers we could look in the literature about multifidus dysfunction. But of course, in your world, you looked at it differently. You didn't have the training and how the muscles work together and motor control retraining and how everything works I guess in an orchestrated way. And your world was quite different, looking at pain generators and how to manage pain generators. So one of the things I've been able to do and enjoy doing the most is help physicians understand how muscles work together and the importance of muscle and normal muscle function as it relates to back pain. So that's been a really nice thing for me in this position to bring physical therapy and particularly pain physicians together and get them speaking somewhat the same language.
No, for sure. That's beyond important because us as doctors, I have a lot of patients ask me, so can you just tell me which exercises to do? And I'm like, well,
Yeah.
I'm the doctor that writes the prescription for you to go to therapy. Yeah, there's some basic exercises I can show you and, things you can do at home, but I really want you to see the expert, who really can individualize that treatment for your muscles to make them stronger.
Yeah, that's a great point. I appreciate you bringing that up because I get frustrated when a physician asks for the multifidus exercise. Just send me the exercises. Well, I need to see the patient, right? Because there are
Right.
so many different influences that can affect motor control. Like sometimes simple hip stiffness in one hip can be what's driving the multifidus problem, or even an ankle problem. So we have to look at everyone. And as you say, that's a perfect word. We individualize programs to help restore normal musculoskeletal function. So it is hard. You think it's a muscle problem, just strengthen it. And if it were that simple, we would have solved this a long time ago. It's just, there's a lot of nuance to it.
For sure. So let's back up a little bit so people at home can understand, like, what is a multifidus muscle and why is it important?
Yeah, so your core muscles, if you will, that support your spine are basically broken into two primary groups. The deeper core muscles, which is the pelvic floor and the diaphragm, and the deep stomach muscle, transverse abdominis, and then the multifidus in the back. And we've just found that the multifidus muscle of those muscle groups tends to be the leader in both shutting down or having dysfunction, as well as when we normalize that muscle, the other ones tend to come along. And of course, we treat the other muscles as well, but those deep muscles basically guide your spine through small little movements. They make sure everything's aligned okay. They make sure there's no slippage between vertebra, and they communicate with your brain to tell the bigger muscles what to do or what not to do. So it's this deep stabilizing motor controlling system. And then the other group of muscles are the outer core muscles. And those are big muscles that we think about working at the gym, doing big strength, like your big rectus abdominis in the front, or your big oblique muscles on the side, your big thick back muscles in your back, and even some hip muscles. So the outer core, the big muscles are fun to train. That's what maybe makes us look good. But we've learned that dysfunction in the deep muscles tends to be the driver in most people with back pain problems.
Oh, for sure. And I know Mainstay has developed this ReActiv8 device to help people overcome some of that shutdown that happens with chronic back pain. So that neuromodulatory control from our brain all the way to our spinal muscles has been interrupted in chronic pain. And this device is basically trying to reset that system to help with pain and restore those muscles, which is so fascinating.
Yeah, it is well put, and it's just a really interesting way that we do it. It's so simplistic. I think people just overlook the simplicity of it. We know that certain types of back pain are driven through, as you said, this inhibition or shutting down of the deep muscles, particularly that multifidus muscle. And when that muscle shuts down, the whole core control system changes because your brain has sort of backup ways to run your body. It's just not efficient. And if you run on a backup motor control system too long, that contributes to chronic pain. So to bring the muscle back online, to get the whole system working together, we basically stimulate the nerve going to the muscle to get a muscle contraction. So the therapy puts an electrode right next to the nerve going to this multifidus muscle, and it essentially contracts the muscle just like we would in rehabilitation, and then it has it relax. And it's very simple. It's not on when you're up moving around. You actually lie down, get comfortable, and turn the device on. And then the device delivers these perfect muscle contractions of the multifidus. And we get about, 30 or so of those in a row. And so that's the treatment over time. So we say, you do it a couple times a day, you may get 100 sort of perfect contractions a day over a 100-day period. So let's say 100 contractions for 100 days resets that whole system, and then people start moving better, and then eventually their pain gets better. So it is a rehabilitative play. It's certainly nothing that covers the pain and makes it go away immediately. It literally restores that motor control, giving you the opportunity for normal function.
Yeah, it's really fascinating how the technology works. And like you said, it's so simplistic, but yet it's an advanced technology. And I see a big future for this. It's just in its infancy right now. I know that a lot of research studies have been going on now for a few years, and about 1,000 patients are now implanted in the U.S., if not a few more than that now, based on those numbers. But it's exciting.
Yeah, no, and the outcomes are great. I've been involved since the beginning. We just didn't know, and it was a true development, startup process, scientific process that we went through, and we didn't know how well it would work, but we certainly knew the importance of delivering the stimulation to the muscle. So the technology was developed. How do we get the lead in place and everything? And I'll say that a lot of stimulation devices for other purposes leverage their technology. They have real fancy waveforms and do really fancy things with electronics and programming. Ours, again, we're just creating a muscle contraction. So there is some beauty in the simplicity of it. But in terms of the clinical outcomes, we did several studies to see how well it worked. And then now what we're seeing in commercial use, what we call our clinical use, where someone that's not part of our research team, a physician out in the community, implants the device, and we're getting quite similar outcomes. So really nice outcomes with this. So we're excited about the future. Unfortunately, the reality is there's, depending on how you do the math, there's maybe as upwards of 1 million people, adults in the U.S. today that have this problem.
Yeah, it's a lot of people. And I know based on the approval for the device by the FDA, they noted that there needed to be physical exam signs, 2 tests that we do as physicians, or MRI assessment of the atrophy or fatty infiltrates in this multifidus muscle. So I know people at home are probably thinking, well, how do I know if I'm a candidate? So what would you say to people that are seeking some kind of treatment for their low back pain? What should they look for at home?
Yeah, it's a great question. It's a pattern that we'll describe here. But the first thing I want to say is if you have pain that's shooting down your leg past your knee, like sciatica, then this device isn't for you. There are other devices that can be very effective for that. So that's number one. What it's not. What it is, it's for patients with this underlying muscle deficit that shows up in about three different ways. One thing that we see is these are patients that in the past maybe got some treatment, got some good rehabilitation or chiropractic care, and they did okay for a while. And then all of a sudden they do one little simple move like they reach or they just bend a little bit, nothing heavy, not lifting, just something very trivial, we call it something simple, and their back goes out and they feel the pain and then they get this muscle spasm and they have to lie down. They maybe try some exercise, they try some relaxation, and they start feeling better. And then they're up moving around. They're a little cautious on how they move because they don't want this to happen again. And so another little simple movement sets their back off. And over a period of often years, their back pain episodes become longer, their functional episodes become shorter, and all of a sudden they realize, holy cow, I've got pain every day now. I can barely brush my teeth. That hurts. I can't reach down and take care of the dishes. It's affecting everybody around me. And that manifests into this chronic pain. So simple little movements that set your pain off is one thing. If you're avoiding things that you like to do because you know you'll pay for it later, that's a sign that you have this underlying muscle problem. And then near the end, if you sit or stand for a prolonged period of time, you'll start to feel those spasms come on, and you know that you're in trouble then as well. So those are the sort of clinical story of the patient. And when you feel those big spasms and pain, that's those outer muscles trying to do the job of the deep muscles. The brain, again, goes into that secondary motor control approach, if you will, and it's not sustainable. So pain that's waxed and waned over time, small things that set you off, and that you know there's things around the house and everyday things that you've just chosen not to do secondary because of your back pain.
No, these are great tips for people. And obviously, as a patient, I mean, you don't need to know what's wrong with you. You just need to seek out the right professional to help you get to what you need. And ReActiv8 is a new device that's really been game-changing for so many patients now.
Yeah, and I would just add one thing to that. One thing that is frustrating for this classic sort of patient that we're talking about is they go to different physicians. They've been to rehab and it helped for a while, but now it's not helping. They go to different physicians, often look for surgeons or other specialists, and they'll look at their MRI and look at their condition and go, I don't really have anything to offer. And so the patient starts thinking, well, gosh, my back really hurts, but there's no specific medical diagnosis associated with it. And so we group this into non-specific back pain, but now we know it's really coming from this underlying motor control loss and the multifidus muscle dysfunction. So we do feel like now we have a diagnosis for a lot of those people, and just that in of itself can be somewhat relieving. They can relax and say, oh, okay, gosh, we do have something for this. I do have something that now we can potentially fix.
Amazing. Thank you so much for joining us today. We really appreciate all this information about ReActiv8's peripheral nerve stimulation for chronic low back pain. Mainstay Medical is so lucky to have you.
Oh, great. Thank you so much for having me on. It's a pleasure to share this with you, and keep up the great work.
Thank you. We'll see you soon.
Thanks.
I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine in Houston, Texas. And this is Pain Diaries. Take care of you so you can take care of business.